In less than 3 weeks, fall begins. That will mark the start of 3 seasons since the COVID-19 pandemic began. No other crisis in our recent history has called on our bravery, on our commitment to each other, and our unity more than this crisis. It calls on us to be informed. It calls on us to be responsible, and it calls on us to be motivated. It calls on us to act with one another's health in mind. To that end, we've taken steps as a city to lower the transmission of the virus, and these steps have allowed us to see a measure of success in recent weeks. So today, Dr. Kane, the great leader of our Marion County Public Health Department, will update us on the most recent data. But first, we do have several updates around restrictions that I want the residents of the city of Indianapolis to know, be aware of, and therefore act upon. First, the main road closures for our Dine Out program, which include Mass Ave and Broad Ripple Avenue, those road closures will end after Labor Day as we transition to a more sustainable model that we hope will allow us to keep expanded outdoor seating in place. That being said, we continue to encourage businesses and restaurants to arrange for outdoor seating and dining while weather permits. And our Department of Public Works and Department of Business and Neighborhood Services stand ready to continue helping area establishments creatively expand their outdoor capacity, including the use of the public right-of-way where it is feasible to do so. One last note on these street closures, as I know it will come up at some point. Yes, I have been personally impressed with the usage of these temporary public places and spaces, especially as multimodal thoroughfares. And that's why I can understand those who are pushing for permanent closure. But to be clear, despite the great partnership we have enjoyed with Park Indy under the city's long-term parking meter contract, there is simply no financially feasible way to permanently close streets within downtown parking meter zones governed by the 2010 contract that the city of Indianapolis entered into. The cost would be in the tens of millions of dollars before a single penny is spent on design or construction. So while we'll continue to study the long-term methods, the long-term needs of our commercial corridors, right now my focus continues to be on using limited city resources to help those utilizing these streets today and others around the county. And to that end, I am heartened this morning to report that based on the encouraging data that Dr. Kane will discuss in a moment, beginning next Tuesday, bars and nightclubs in Marion County will be permitted to reopen at 25% indoor capacity, with up to 50% capacity utilizing outdoor seating. I want to make two important points here. First, the reopening of these venues will only allow bars and nightclubs to offer table seating. And when I say seating, I mean that it will be mandatory for customers to be seated at tables no larger than what we will accommodate 6 people. And bar top seating will continue to be closed. Secondly, the reopening of these venues will only last so long as business owners and customers take their obligations under these public health orders seriously. For residents, customers, that means staying at your table and masking up whenever you need to move around. And I promise you that Dr. Kane and her team will go full footloose on your business if you're operating as a dance club. As it relates to all other aspects of our existing public health orders, they will remain in full effect for the foreseeable future without change. I know these updates will not satisfy every Indianapolis resident. You know, I wish I could satisfy all residents. Those who own businesses threatened by closure, those who fear a previously non-fatal health condition could become fatal with COVID, those who resent the mask order, those who want more to wear masks. Sometimes the decisions I'm required to make please no one. That is why it is important that I make them. Not to please people, but to protect people. Because as I said earlier, this is a moment in which we are called to unite around reliable, discernible science, around shared responsibility, around mutual respect for one another, for each other. 6 months into a global pandemic, we can all see which nations can reopen safely and which are still battling a growing rate of infection. Simply put, unity is what stops this thing for now. To those who mask up for the health of your neighbor, thank you. To the businesses that take these orders seriously and in so doing protect their employees and their customers, thank you. Because of you, we can make these adjustments after seeing the rate of transmission decrease in Marion County. Going forward, we will continue listening to community feedback and, of course, medical experts while monitoring the data.